Hello and good afternoon once again. Dr. Alalade here at AsktheGynaecologist, and tonight, this evening, we'll be doing a quick marathon session to talk about things that are very, very peculiar and very, very important regarding male causes of infertility. And once again, I want to say good evening. Sorry that I've not been online live for the last few days. I've been in transit traveling up and down, so it's been difficult to connect while traveling, or especially whatever you are driving. So I've been on, not really online, but I've been in the background checking things and ensuring that we are still where we're supposed to be. So once again, I want to say apologies for that. But sometimes there's some things that you have to do, that you got to do as a person. So I say thank you, and everybody, welcome today to this discussion with Ask the Gynecologist. My name is Dr. J at Ask the Gynecologist, and I have the pleasure of presenting to you and talking to you today about the causes of low sperm count and how we can treat them. So if you're free, let's have a quick chat together, and it's going to be amazing. I know that the backdrop I have here, this is my whiteboard. Sometimes when I'm documenting on it, it comes as a reverse while I'm talking live. But in the next few days, I'm going to get it edited and published and put it back as it's supposed to be on the YouTube. So if you want to watch our stuffs on YouTube, you should subscribe now. The reason I say subscribe to YouTube is simple. On our YouTube channel, we put our videos chronologically so that you don't miss any discussion. On our YouTube channel, we put our videos sequentially, chronologically, so that you don't miss any discussion. And in case you miss any discussion, you can always catch up on our YouTube channel. And the most important thing is that you also ensure that you are registered or you are subscribed to our YouTube channel so that you don't miss any of our video. And peradventure you are new here, I want to say this is one of the biggest groups on Facebook on Facebook now, where we talk about female gynecological issues. So if you're a lady, you're on Facebook, you should be on ATG, because on ATG you're going to learn a lot. By the time you're talking around your friends in the church, in the mosque, in the society, in the meeting, you'll be saying things that are very, 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 very sound, and they will know that definitely you are part of a group that they talk about female gynecological stuff. By being here, even spending only 3 to 4 weeks on our program, watching every day, you will be sound medically in terms of gynecological problems, and you're going to be a different person entirely, positively, by being here just alone. So if this is your first time watching us, I want to say good evening to you. And I can see so many people already on Facebook now watching us, and also on Instagram. We talk simultaneously on Instagram and on Facebook together whenever we publish. And I can see Scholastica, Chinweoku, Tony Epo, Kebonye, Matsokuma, Motswakumo, Oluwakemi Bandele, Christina Onwachuku, Tony Epo, Olori Abisoyege, Ifeoma Olawepo Palmer, Ifeoma Palmer. Thank you so much I can see you today. You're so beautiful. Thank you for being here with us. You're a wonderful lady. Adebanke Adebanyo, Alimi, wonderful lady as well. Inche Kwebe, Emily Cheesy, thank you so much. I can see Ajara Isa Subar, Chidima Ada Onoha, Ruatoso Okusonya, Aketua Melu Opeolua, Suzanne Isenth. Thank you guys for being here. Evelyn Anthony. And on Instagram here, I can see so many people watching us. Unfortunately, on Instagram, it's difficult to pronounce the names because the names on Instagram are like nicknames. Marval64. To consult with me one-on-one is very, very easy. Just follow this instruction. First of all, one of our team members will probably bring up a link and give you an email address to send your request to. Peradventure they don't bring up quickly, just go to the page of our Instagram and you see our email address. Send an email there and the manager will get across to you tonight. Worst case scenario, tomorrow morning, because they've closed at the laboratory now. I should send you details on how to register for our consult service one-on-one. And once we get the details, you register, you get my WhatsApp number, and I can chat with you and go through your medical concerns, and then you can be happier and a better person. So Marval64, just go through the link, or I can give you our email address if you prefer. ATG Services 2018. ATG Services. ATG, then Services, all together as one word. 2018, all together as one word, at gmail.com. ATG Services 2018 gmail.com, and they will reply to you, or go to our front page on this Instagram and you get the links to join to our email, and we'll send to you all the details you need to join and to subscribe for one-to-one consultation. Shola Betsman Shamja, thank you so much. I'm going to talk about today. I'm talking about low sperm count, so just chill and stay tuned and be coming down simply. Victoria Onyeka Inziako, thank you. Jane Murphy, Otogo Lizzie, Joy Romain, and we have Farida Umar, Shola Besman Shamja, Victoria Onyeka Inziako, Aflayan Taiwo Agikawe, Esther Stephen Eliachi Chinyere Abba Norm, Esther Lamide Onifawenyimi. Thank you guys. And Chiamaka Amadi, Vera Umwachuku, Okuzwa, Osato Hamwen, Osanyode, Answer Ogechi Ifeanyi. I'm doing well, and how are you to answer Ogechi Ifeanyi? Temitope Akinson, a wonderful lady. Dada Oluwani Femi Motuayo, Chidima Ununu, Debbie Chris Eguatu. I'll start now. So if I've mentioned your name or I've mispronounced your name, please forgive me. But I need to get on the board now and start this discussion because people are watching and they're spending time and their data. Yeah, thank you, Marvel. That is the email address. Thank you. So first of all, what is low sperm count? To know that you have low sperm count, probably you've been trying with your wife to get pregnant, or you've been trying with your spouse to get pregnant, or you are the guy or the lady and you've been doing things and nothing's happening yet. And you're wondering that, oh, maybe we have low sperm count, and you want to get diagnosis. You want to know what's going on. So two of you, your wife, yourself, or you and your husband, you go to the laboratory. For example, you go to the ATG laboratories, and they've taken the sperm count of your husband, and we've examined on slide, and we do a count to know, is the sperm count good? Is the sperm count low? There are a lot of criteria, about 5 of them, which we check. We call them parameters. We check for your sperm to know that the sperm is good or not, or whether it's optimal or not. And we also do culture sensitivity, where we culture your sperm of your spouse, of your husband, to see if there's any possible infection that could be affecting or causing low sperm count. So these are the things we do, okay? And once we've done the test and it says, oh, Mr. Man, gentleman, your sperm count is low, what does it mean? It doesn't mean you can't get pregnant, okay? Sometimes there's very little number of sperm in the semen in the ejaculate. So there's little number of semen of sperm in the semen. Sorry, okay. So we've done the count and we see that the sperm is very, very low, but it's still there. In some cases, we might be able to do what we call IUI, where we take the sperm, the birth sperm, and we get it into the womb or into the egg to get you pregnant. Sometimes we can't even get any sperm at all, azoospermia, and there's nothing. Sometimes there's good sperm, but they are very scanty. And we have abnormal sperm, which are very, very abnormal. Some sperm, they have 2 heads. Okay? You see a sperm like this. The sperm has 1 tail and has 2 heads. Okay? Or sometimes it has 1 tail, 1 head and 2 tail. So you see the sperm like this. This one here wants to swim here. This one wants to swim here. And the sperm is confused, it's swimming, they can't move anywhere. If you've seen sperm under microscope, some sperm, they are confused. Some sperm, they will swim small and they'll get tired and they'll get stuck. So we have different type of sperm. But what we want is that we want the sperm to have its own head and a long tail, okay? Inside this sperm head here, there's a genetic material, okay? And once the sperm enters into an egg, the genetic material will move into the egg to get the egg fertilized and becomes a baby. So there are many types of sperm. Some sperm, their tail is so short. Okay? Some sperm, their tail is basically non-existent. Some of them, they are so tired, they swim a little bit and they get stuck and they fall tired and they slip off and they die off. Many men, their sperm is like that. That is why the number one thing that can cause your low sperm count is, first things first, avoid unnecessary increase in temperature in your scrotum. If you're a long distance driver, you're always on the computer at home, you're working the computer, you're not moving about, allowing air and fresh air to blow under your groin, you're causing excessive temperature, heat under there that can damage sperm. It is very, very important for you to listen to me. Wearing tight pants consistently all the time, tight pants that are non-cotton, tight pants that are rubber pants, It's not good for sperm production. If you have any baby, any child, male child around you, avoid wearing tight clothing for them. If they wear pants, let it be 100% cotton. I still remember at the age of 7 or so, I was in a church service and somebody was giving a health talk. And that person mentioned about this issue about sperm, people wearing tight pants and they destroy sperm. And since that day, he said, I wear no pants, or if I'm wearing pants, it must be 100% cotton. 100% cotton. If you have a male child at home, nephew or anybody male at home, they must wear 100% cotton boxer, 100% cotton pants, or nothing. Importantly, male child, 100% cotton pants or cotton. Okay, let's proceed. So, if you've done test and it comes back that the sperm count is very low and we have to treat, please hold your questions across the board. Hold your questions, okay? I'll take questions shortly after discussion. Okay? So, what can damage sperm? It's very simple. If you're an alcoholic, we all know that. Alcoholism, taking excessive alcohol, has a perfect way of destroying. What? Of destroying sperm. You being an alcoholic, you're going to destroy your sperm. Being overweight increases the temperature around your groin that damages your sperm. You're a smoker, you're damaging your sperm. You're a man, you don't smoke, you don't drink alcohol, but you don't get regular exercise, you're always sitting down at home on a computer all the time, you're going to damage your sperm. You need to be moving. You're a long distance driver, regularly take a time off and allow your body to recover. Okay? Some people, they do all of it, everything they need to do, but their sperm count is still low and they wonder what is going on. Hormonal imbalance for the man can cause low sperm count. And how does this function? I always find a way of explaining this to people. How hormonal imbalance can affect sperm production. And listen today. Now, this is your brain. Under the brain here, we have a gland, okay, man and woman, called anterior pituitary gland. Let's put it here. Anterior pituitary gland. Okay? This gland produces hormone, FSH and LH hormone. This hormone, they go into your bloodstream and they go and act on the what? Scrotum and testicles of the man. Okay? They go and act on the scrotum and testicles of the man. There's this, my model is behind me there. So, these testicles here relies on the release of this hormone to work on it, to produce sperm. Okay? If this hormone, two of them, they are very low, we call it hypogonadism. Therefore, these testicles here is able to produce sperm, but because it's not getting the energy, the sense to say, Mr. Testicle produce sperm, they don't produce sperm. So if a man suffers from hypogonadism, okay, and the person is not producing this hormone, or these hormones are very low, they won't produce sperm. Despite the fact that the testicle is okay, despite the fact that there's no blockage in the exit here, okay, the person has or is going to have a low sperm count or no sperm at all. That can happen in people that got a disease, very, very rare though, but it's happening now in Nigeria, called Klinefelter syndrome. Excuse me, let me write it down properly here. It's called Klinefelter syndrome. Klinefelter syndrome. That syndrome is a genetic problem and it makes men not able to produce sperm at all. Sometimes they produce sperm but it's very, very low in quantity. That one is not, we can't correct that one. No. We have to do sperm donor for that one if this man has no sperm at all. Now let's continue. Now, if you're an alcoholic, you're smoking, stop it. Remember I talked about regular exercise. If you're doing exercise as a guy, do it moderately. Okay? Some people, they are very, very overactive. They take what we call anabolic steroids. Steroids to make their muscles grow bigger while they do exercise. Those steroids can destroy the testicles. Those steroids make the body feel as if they're not to produce these hormones, and those hormones that people take to build their muscles, when they're building muscles, it makes the testicles shrink, and the testicles not to produce sperm at all. If you're a man, you're into gymnasium or muscle building too excessively, you're taking steroids injection to boost your muscle bulk, you can damage your sperm count. Avoid them. Some people, yes, they are taking cancer medications for some diseases. If you've been diagnosed with cancer, which is very, very rare in any part of your body, and you're going to be taking medications to treat that cancer, if you've not yet had babies, okay, I'll suggest before you start medications, talk to your doctor so that they can collect your sperm and they can possibly freeze them and use it to get your wife or your spouse pregnant in future. Chemotherapy medications, cancer medications can destroy sperm. Some medications that are antidepressants for treating depression and treating people that have mood problems, antidepressants too, they can damage sperm. So you must let your doctor know if you're on any medication that has the potential of damaging sperm, or if you're on any medications that you don't know about that are very, very strong. Let your doctor know, because these medications could be the things that are damaging your sperm. If you're taking Igbo, marijuana, cocaine, all those things, what we call them recreational drugs, they can damage sperm. Be on the lookout. Some people, when they are born as babies, their testicles does not descend from their abdomen. So this is a man, okay, and this is the tummy, okay, this is the leg. The testicles, when a baby is, before they are born, the testicles is always inside the abdomen. But towards the end of a pregnancy, the testicles will move out and stay in your testicles there, in your scrotum there. Some people, their testicles does not descend down into their scrotum. It gets stuck in their tummy. And because the testicles is not meant and designed by God to be in the tummy, the temperature in your tummy damages sperm production. That is why your testicles must migrate outside to stay outside here. Because the temperature needed for optimal sperm production, the temperature needed for the best production of sperm is slightly a bit lower than the core temperature inside. The temperature your scrotum needs to produce sperm properly is slightly lower than your core body temperature. That is why for every mammal, that is the vertebrate, obviously, the testicles must be outside. Every mammal, the testicle must be outside. That is a vertebrate. Look at them all. So if your testicles of that boy, of that your nephew, is stuck in your tummy, in the tummy, and it's not there, you check the scrotum, you can only feel one, or you can feel no testicles at all, then they must get MRI or CT scan done to locate these testicles in the tummy. And usually by surgery, we bring it down. Otherwise, they will be not able to produce a baby themselves. Or we call that undescended testes. Again, undescended testes is a common cause of infertility. If you've had any operation before for your testes, you've had any operation before for hernia surgery, you've had any operation like this before, they can damage your testicles or the connections in the tubes that leads the sperm from testicles outside. One example is varicocelectomy, to treat engorged veins in your testicles. Remember I said being obese, being overweight can destroy testicles, can destroy sperm production. Being obese makes your temperature outside in your testicles, in your thigh, in your groin, a bit higher than expected, and it gives problem for testes to be produced properly. One of infections, sexually acquired infection, what we call STD. STD, especially gonorrhea and chlamydia. They have the potential of destroying the cord. You see, there is a tube that leads the testicles. Let me use my red pen here. Remember, I said this is the testicles here, this round thing here. Okay? Two of them. There's a tube that links these testicles outside, so that when the man ejaculates, the sperm will be there. This red tube, okay, can be blocked by infections like gonorrhea, chlamydia. They can block the tubes. If you've contracted gonorrhea before, chlamydia before, ensure you are well treated on time. By not being treated of such infections on time, you're going to risk potential of damage to your testicles tubes that lead. We call it seminiferous tubules. Forget about the name. Basically, it's a tube that leads your testes your testes to the exterior, so that whenever you release sperm, they come out. Some people will tell me, okay, doctor, but whenever I release semen, there's liquid. How come you say that if I have infection that blocks my tube, they have no sperm? Let me tell you, whenever you are being stimulated, you go into orgasm, you release this fluid. The fluid you release is semen. That fluid is not produced in your testicles. It's produced in a separate gland. But before that fluid comes out, the testicles will release sperm to go and join it and release out. If the link between the testes to release the sperm to go and join the fluid is blocked by that infection, you'll be releasing blanks like a soldier shooting bullets, and that bullet has no gunpowder. The bullet is the semen, but the gunpowder that will get your wife pregnant, that will cause an impact, is the sperm. It's not there. So you are releasing water, you are releasing the water, but the sperm, the gunpowder, to cause to cause belly, is not inside. The link that releases this sperm from the testicles to go and join that fluid, the seminal fluid that comes out, if that link is blocked by chlamydia and gonorrhea infection, you cannot produce sperm. So let's go back. Number 1, smoker, alcohol, marijuana, cocaine, sperm production damage, obesity, walking too long, driving long distance car, not allowing fresh air to blow into your groin, damage sperm. Testes not descended, damage sperm. Previous operation that it was not done properly, complications, hernia surgery that was complicated, varicocele, undescended testes, damage sperm. Klinefelter syndrome, genetic problem, no sperm, damage sperm. Infection, chlamydia, gonorrhea, damage sperm. The more you have sexually acquired infection, the more damage you have. The more infection you have, the more damage. After a particular infection of chlamydia or gonorrhea, it causes damage to the sperm tubules. The damage could be little. You have another infection again of the same kind, you have another cumulative damage. The more infection you have, the more damages you're going to have. So number 1, how do we treat low sperm count? The first things first is to cut out any stimulant. Whether you're using stimulant to boost your muscle bulk, regular exercise like that, you're using stimulant to boost your muscle bulk, we call them anabolic steroids, stop them. You smoker, cocaine, alcohol, ganja, anything, stop them. Regular exercise. Regular exercise boost your testosterone level and boost sperm production. Check your sperm count. Okay? If it's very low, we check your hormonal profile, FSH, LH. If it's too low, we might give some injections to boost your hormone production here to assist production of sperm. If you have very low hormone, we can give some medications to try and see if these medications will help to boost your sperm production. If it doesn't work out, we check for infection in your semen production. If there's infection there, we treat it. It might assist to boost your sperm production. We give you some vitamin supplements, which are also able to boost your sperm production, contain mainly antioxidants. Okay? If you have infection like Staph aureus, we have infection like gonorrhea, chlamydia, we treat them. E. coli, we treat them. And treat them as soon as possible to prevent any damage. Clomid is not for low sperm production, no. Clomid is to stimulate egg production and to harvest egg. Clomid is not for sperm production. Clomid is simply for stimulating eggs to release eggs. Stimulating ovaries to release egg. Okay? That is for non-year blessing. Okay? Poviron is iron tablet. It's not for low sperm count. Poviron is for iron tablet. It's not for low sperm count. Poviron is used for low iron. It's not for sperm count too. Let's continue. If we've done all these treatments and everything is failing, we've given the hormone boost because you have low sperm, low FSH LH, still yet no sperm production, we might need to do ultrasound scan to check to see if there's any possible blockage. Okay, and if there's blockage there, not allowing sperm to come out, what we can do is to see if we can aspirate sperm directly from the testicles. What we call surgical sperm aspiration to get you pregnant, your wife pregnant under IVF. Some people there's no hormone is okay, but the sperm is still not being released out. That could be because the blood is blockage. If your hormone profile is okay, but still your sperm production is very, very low, it could be because there's a blockage, not allowing sperm to move from testicles to go and join the seminal fluid. If there's that blockage there, what we can do is to go and aspirate the sperm directly, and it's your own sperm. We use it to get your wife pregnant. We call it surgical sperm aspiration. We do that under IVF. It can be easily be done. If you're watching me on Instagram, thank you. I don't want to miss any questions here on Instagram. So if you have any questions for me on Instagram, please text it here. JZ Lumen, you're not late. You're here. You can watch the video all over again on the channel here. So let's start taking questions now before we round up this session. And we open another session in the next 10-20 minutes again. Next 10-20 minutes, we have another Facebook session teaching. So don't miss the next one coming up in the next 10-20 minutes, okay? I'm going to go for a break now, and I'll be back. Someone is asking, how does water look like without the gum? See, your question is, you remember, I said that if there's blockage of the link of that tubes that link your testicles to the seminal fluid, the person is releasing semen, but there's no sperm there. The color of that seminal fluid of someone that has blockage and someone that has no blockage is the same. You cannot see just by looking at the seminal fluid and say this person has no sperm count, that person has no sperm count, or that person has okay sperm count. You can't. They all look the same. But under microscope in the laboratory, for example, our laboratory, will be able to know if there's any problem with your sperm count. So, someone is asking about motility. Motility is the movement of the sperm. I can't really discuss that here because I got no microscope to show you directly. But if you're here at the beginning, Olubenga, I mentioned that sperm, whenever we are doing sperm analysis, we have 5 separate criteria. 5 separate criteria. Okay? So you remember I mentioned about 5 separate criteria. Okay? Can someone blood out of a man? Achebe, I don't get your question. Ajoke, azoospermia means this person has no sperm at all. They've done the specimen analysis and there's no sperm at all in the semen ejaculate. There's no sperm at all. That's azoospermia. In such people, what we try to do is we try to see if we can get sperm aspirated from testicles. And if we can't get sperm from testicles, we have to use sperm donor. Okay? Okay. Someone is asking, what can be used to treat motility? What we do is to check for any infection, and we treat the infection, and we also give you antioxidant to boost your sperm count. We have things like Proceed lubricant that can help as well. We have antioxidants, vitamin E supplements, and they can help boost motility. And with regular exercise as well. Good evening. My period. Okay. Hold on. Hold on. Someone's asking a question here about period. So oligospermia, the treatment, usually exercise. We stop any medication that is causing low sperm count. We treat for infection. And we check your hormone profile as well. And with regular exercise, we're usually able to boost oligospermia. But if everything fails and you're still suffering from oligospermia, that means there's still sperm count there, very, very low. We can go for IUI, or IUI or ICSI, okay, to get you pregnant through IVF. Your period is delayed for 5 days. You took letrozole in your last cycle, You're currently treating UTI. What could be the cause? Nothing. Just repeat your sperm count, your test of pregnancy in the next 5-6 days, okay? And then we take it from there. You could be pregnant, but the first thing to do your test of pregnancy in the next 6 days or so to see if you're pregnant or not, okay? Someone's asking a question about retroviral drugs and infertility. Yeah. So there's a question here about retroviral drugs and infertility. Retroviral drugs are medications we use to treat or to manage, not treat, manage HIV infection. They are antiviral drugs. They affect a lot of things about the DNA. So definitely they will have an effect on sperm production. They will have an effect on sperm storage. So what we usually do is but it does not say you won't have any sperm at all. It might cause oligospermia. What we can do is obviously before if you're suffering from that situation and you want to get your wife pregnant, if your wife is not HIV positive, we can collect the sperm, wash the sperm, okay, and then try to use it to fertilize the egg and then do transfer. We can even use this for IUI, but we wash the sperm and ensure that we're not getting any infection to that person. Somebody with sperm count of 3 million can get pregnant, but definitely you're going to need an IUI, stroke IVF, to assist to getting you pregnant. Somebody wants to send us your medical information, you can't send it here online. You have to use the premium services, okay? Okay, good. My husband doesn't produce sperm on time. When it does, it's very little. It could be stress. He's stressed out. It could be stress. Okay. Can cimetidine cause low sperm count to an extent? Yes. Thank you, Betty Skulls. Olori Adehun, Denzel for life. What's the work of clomid? Clomid is used to stimulate the eggs and the ovaries to produce egg. But you have to be careful. Don't ever take clomid without recommendation from your doctor. Clomid has a way of damaging ovaries too. It has to be used in moderation under the care of your doctor and ensuring that you have regular follicular tracking scan done because it's a drug that has serious consequences. Never ever take clomid at home without guidance and recommendation from your doctor. Clomid has its own issues. So never ever do it at home. Don't ever take clomid on your own without guidance from your doctor. Without guidance. Never ever take clomid without guidance from your doctor. Again, I repeat, never ever take clomid without guidance from a doctor. Thank you. So I'll go off now. I'll be back in about 10 to 20 minutes time for the next session, okay? God bless you and thank you so much for watching tonight. I love you so much and hope to see you soon. Have a wonderful weekend and have a wonderful day. Bye-bye.